How did that feel?
That was crazy. I was so stiff when I came in, and now it's like, feels a lot better.
Good. Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now you guys came from North Carolina, correct?
Yes, sir.
Perfect, perfect. That's what I like to hear. Now, as I was reading everything, primarily everything is kind of middle back, lower back, and knee pain, correct?
Exactly.
Okay. Is it both knees?
Yeah, both these.
All right, both knees. Now, do you feel pain from the low back? Does it travel down from the back going into the knee, or?
Yeah.
Yeah. So you do feel kind of like a radiating. Does it go any lower than the knee?
No lower than the knee.
No lower. Okay. How often do you feel this?
Just basically every day.
Okay, every day. Anything that you do that kind of makes it better or makes it worse?
I don't really do anything to take care of it.
Okay, but at work when you're on your feet all
Work at the
day.
gym.
Okay, so that you feel putting a toll on everything there.
Okay.
What I'm first gonna have you do, I'm gonna have you stand up for me. So I want to go through a range of motion just to kind of get a baseline where we're at. After we're gonna do some orthopedic tests in the low back. But to start off, if you can just bend forward at the waist. Does that cause any pain when doing that?
No.
Okay, good. Come up like this, lean back. Any pain with that? Good. If we're to come down to either side, any issues there? Good. And then if we're to rotate, any pain with that? No? Okay, cool. I'm going to have you lay on your back for me, please. Okay. So I'm going to raise one leg up at a time. Let me know if you feel any pain in the low back or in the hips. Granted, you might have tight hamstrings. And any pain with this? Any pain if I bring that down? Nope. Good. I'm going to cross the knee over. Any pain in the low back or hips when I push down? No. Good. We're going to do the other side now. I'm going to raise this leg up. Any pain in that low back of the hips? No. Any pain here? Good. We're going to cross. Any pain in the low back or hips? No. Alright, I'm going to have you flip over on your stomach. And actually, I'll take your glasses from you. Okay. Perfect. Yeah, you can just relax right there. Alright, what I'm going to do, I'm going to bend this knee. Bring the leg up like this. Any pain with that?
No.
Okay, good. Any pain if I bring the leg in?
No.
Or if I bring it out?
No, we're good.
Okay, good. We can do the same thing on this side here. Any pain with that? Good. Any pain if I bring the knee in or the leg out like this?
No.
Okay, perfect. So good to see that we're not eliciting any positives with the orthopedic test. But yeah, let's go ahead. We're gonna start with scanning the entire body. I want to see, and feel any like tight muscles, any taut tender fibers, things like that. So we're gonna scan the entire body. We're gonna check that symmetry from the right side to the left side. We're looking for everything to be balanced. So we're gonna start with palpation. Let me know with anything that I do if it is tender to the touch. Okay.
Okay.
So we're gonna start up in the neck. Okay, any issues up through here? Good. So we're going from that cervical spine, going into the thoracic. Let me know if anything is tender when I push in.
That's pretty tender.
It is a little tender through here? Okay, so we got some tenderness in that mid-back. How about through here?
Right.
Okay, some tenderness in that lower thoracic spine. Now we're into the lumbar spine. Any issues through here? Okay, definitely. Okay. If I push over that right SI joint, any pain with that?
No.
No? Directly over the sacrum?
No.
Nope. And over the left side?
No.
Good. So we're going to come down to here. Let's check the leg length. So as you can tell, when we bring the legs together, that left leg is short. Now when we scan up the entire body, now one thing that I'm noticing, we got a little bit of raised up right through here on the right side, and then also even right through here, a little bit of raised up when I glance up the body. So what I want to do, especially from about kind of mid back down. This is all a little bit tight, especially right in through here. Very tight. So I'm going to work on this with the massage device, and then we'll go ahead and start the adjustment, okay?
All right.
How'd that feel?
It felt pretty good.
Alrighty. Alright, so from here, what we're going to do, we're going to start off with that adjustment, okay?
Alright.
So I'd like to start up here at the that cervical thoracic junction here. Okay. So we're going to start with the T2 on that left side. Good. Okay. And T1 on the right here. Perfect. I'm going to come up right in through here. What I want you to do, take a deep breath in and let it all the way out. Good. One more time, deep breath in and let it all the way out. Good. Okay. So we did that T1, T2, did a upper and middle back thoracic adjustment. Let's come back down here. Take a look at that leg length again. So still left short, as you guys can tell. So what I like to do from here, I want to see if it's more of a sacral involvement or of a lumbar. I know we're getting positives just with the palpation, with the pushing in. I know that you were tender in some of those areas. But let's check first if there's any sacral involvement. So I'm going to stabilize right here on the sacrum. I want you to raise this leg up as high as you can for me. Any pain, tenderness, tightness with that? A little. Okay, a little bit with that. All right, relax that side. Raise the left side for me. How does that side compare to the other?
It's a little harder than the first side.
A little harder?
Yeah.
Okay, so what I'm going to do, I'm going to have you cross this foot over that foot for me. Good. Okay, so let me show you what is going on first. So what's happening is that left side, it was harder to raise that leg back. So what that's telling me is when I stabilize on the sacrum, your sacrum is actually pointed more towards that right side. So when it's pointed more towards that right side, the ligaments through here are looser, which allows that leg to go up higher, where on this side, everything is pulling more and it's restricted. So what we're going to do, we're going to do a drop. It's a P to A drop, and then we're going to be doing a clockwise torque on the sacrum to get it to point back towards the left. Okay. So now after we do that, after we do the drops, what I'm going to do is we're going to retest again, and we're going to see how that feels for you, okay? We'll see that change. So I'm going to have you come actually down just a tiny bit. Right there, good. All right, cross that ankle over again for me. Good. And the table is going to come up from below. Perfect. Good. I'm gonna have you bend this knee for me. Good, and relax. Okay, so I'm gonna restabilize again. We'll start with this side. Raise that leg up for me, as high as you can. Good. Now raise the other side up for me. How does that side feel?
It just seems the other one.
This one's now easier than this one, correct?
Yeah.
Okay. Yeah, so that already getting a lot more movement on there. Good. All right, so what I want to do, we're going to check that leg length again here. I mean, now even after that, it's almost, literally almost perfect. So that had almost completely balanced everything.
Awesome.
But I do know every time I was pushing in right through here, even now, like I feel like your muscles are guarding and you tense up. What I'm going to have you do, I want you to sit up on the table for me. One leg on either side. Yep. Well, bring this leg on that, take a seat. Perfect. Alright, sit up nice and straight for me. I'm going to have you cross your arm, put it over the shoulder, Okay, there we go, right there. So what I'm going to do, I'm going to rotate you to the side. Now with your legs, kind of keep your thighs to the table for me. Kind of hold yourself there. We're going to rotate you, and I want you to look as far as you can over that left shoulder. There it was. All right, you can relax. Go back, face down for me. Okay. And that actually did it. Perfect. That tiny even bit of a balance. Now I know you felt that one, how the nerves kind of like the pressure got off. You felt the movement. Obviously you've heard and felt the popping and cracking. But what that popping and cracking is doing is removing pressure off the nerve so the body can start to function and heal as intended. Okay. So what we're going to do from here, I'm going to have you. I'm trying to think. You're pretty tall, so. Let me see, I'm going to have you stand up. Let's see if I can do this. I know you're like 6'3", 6'4". Take a couple steps forward right there. Good. Arms up by your side. And put your hands up and over mine.
You need a step stool?
I could. Alright, I'm literally trust fall onto me, fall back. Squeeze your elbows together. Good. There you go. That released real nice for you.
Awesome.
How far down do you feel that go even with that? That one pretty.
Feels a lot.
Alright, take a seat right here for me. Facing that way. Okay. So let's make sure that the rest of that thoracic spine is cleared out. When I say cleared out, I mean no more pressure being put on the nerves. As you guys noticed, I started off and we did a prone thoracic adjustment, then we did the standing intercostal adjustment. Now I'm going to do an anterior or supine thoracic adjustment as well. Okay, so what I want you to do, I want you to take a deep breath in. I'm going to bring you down and exhale all the way out. Good, already cleared out. We're going to go up a little bit higher right there. Deep breath in and out. Good. Alright, relax right there. So now what we are going to do, we are going to do the Y strap today. So this is that manual cervical decompression where you'll feel that all the way up in the neck, just going all the way down the spine. So from here, if you want to lift your head up for me, good. And relax. Now I come up to the top of the table, and from here we're going to distract in that Y-axis, and then we're going to have you nice and relaxed. We're going to give a very nice thrust, and yeah, you may feel that release all the way down. How did that feel?
That's crazy.
Relax for a moment. You feel how that just opened everything up going down?
Oh yeah.
Have you ever had anything like that?
No.
Come on up. All right, so one thing what I always ask every patient, now this is the first time you've ever had a Y strap done before, correct? Like any type of manual decompression. What would you tell people that have never had the Y strap done? How would you describe it to them?
Shit, I don't know, boss. It's interesting.
You just, I mean, you feel how
My back is like,
just pulled apart.
oh yeah.
Good, 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 good. Yeah, that gets a ton of movement. What that does, it's taking pressure off all the nerves, and it's starting all the way up in the neck, and you'll feel it take the pressure off the nerves going all the way down into the back as well. So now with you, what I want to do, just because I want to check out the knees as well, I want you to lay flat on your back for me. Just scoot, yeah, and scoot back for me too. Yeah, come up, perfect. So, because I know you said that your knees were bothering you as well. So I do want to do some leg pulls on you. Just with that, you may feel a release in the ankle and the knee going all the way up to the hip as well. Good. And we're going to do the other set here. Good. Come on up. Perfect. How's that feeling for you?
Feels excellent.
So when you first came into now, do you notice a difference? Just
I was so stiff when I came in, and now it's like, feels a lot better.
good, good, good. All right, perfect. So what I'm gonna do, I want to do a little bit more just soft tissue technique. Actually, where's it at? Down there. So I'm gonna run that on just for a little bit longer, just so we can relax things a little bit more. But yeah, you're all set for today, though.
All right.
Perfect. I'm Dr. Joseph Cipriano, and today, another great adjustment. And if anyone is ever looking to schedule an appointment, just go right online, drjosephcipriano.com. Send me a message. I typically try to get back within 1 to 2 days, so love to get you in here. Have a good one.